Forceps versus snare polypectomies in colorectal cancer screening. Are we adhering to the guidelines? Colorectal cancer, CRC, is the third most commonly diagnosed cancer, with estimated incidence rates of 13% and 12% in Europe and Austria in 2012 respectively, with both rates still rising. There is evidence to support the preventive effect of colonoscopic polypectomy on CRC incidence and mortality. Colonoscopy offers optimal protection against CRC, although it is subject to a number of quality factors, some of which are controllable. First, the rate of missed lesions, which are estimated to account for 20% to 52% of interval cancers, can be minimized during colonoscopy by improving adenoma detection. In addition, excellent bowel preparation, increased withdrawal time of the endoscope, complete examination of the colon, cecal intubation, and previous training have been identified as having a major impact on adenoma detection. Another aspect is the effectiveness of polypectomy itself. The complete resection of precancerous lesions is essential in order to interrupt the adenoma-carcinoma sequence. Estimates of the impact of incomplete resections on the incidence of interval cancers range from 19% to 31%. The choice of inadequate polypectomy instruments might contribute to some of the incomplete resection rates reported. Only a few studies have focused on comparing or assessing the effectiveness of different polypectomy instruments. The European guidelines for CRC screening recommend the use of either forceps or snare for polyps less than or equal to 5 millimeters, whereas only a snare should be used to remove polyps greater than 5 millimeters. Effective and adequate polypectomy is critical to ensure optimal protection from interval cancers. The aims of the current study, therefore, were to investigate the use of forceps and snare polypectomy according to lesion size and shape, and to assess adherence of endoscopists enrolled in the National Quality Assurance Program to the European guidelines. Background and study aims. European guidelines for quality assurance in colorectal cancer screening recommend snare resection for polyps greater than 5 millimeters. The aim of this study was to investigate polypectomy technique according to lesion size and shape, and to assess adherence of endoscopists enrolled in the National Quality Assurance Program to the European guidelines. Patients and methods. This cohort study included screening colonoscopies performed between 2007 and 2013 within a quality assurance program in Austria. Resection technique was analyzed according to lesion characteristics and endoscopy facility, private practices, hospitals, outpatient clinics, before publication of the EU guidelines, 2007 to 2010, and adherence to the guidelines after publication, 2011 to 2013. All surveillance colonoscopies and examinations with missing data were excluded. Results. A total of 128,969 screening colonoscopies performed by 278 endoscopy units were included. The polyp detection rate was 39.6%, N equal 47,797, and 95.6% of polyps were resected. Of polyps greater than or equal to 5 millimeters, 46.0% were resected using forceps and were, therefore, not treated in accordance with the guidelines. Forceps polypectomy of lesions 5 to 10 millimeters and greater than 10 millimeters decreased significantly in hospitals after implementation of the guidelines. Both p less than 0.0001. In private practices, there was no difference in forceps usage for polyps of 5 to 10 millimeters, p equals 0.41, before and after the guidelines, and for polyps greater than 10 millimeters, forceps usage even increased, p less than 0.0001. Endoscopists' forceps removal rates for polyps greater than or equal to 5 millimeters correlated significantly with respective adenoma detection rates, p equals 0.0007, rp 0.187, and cecal intubation rates, p equals 0.0001, rp 0.303. Among endoscopists in private practices, internists had slightly lower forceps removal rates for polyps greater than or equal to 5 millimeters than surgeons, both before 47.2% versus 50.7%, p equals 0.014, and after publication of the guidelines, 51.9% versus 53.5%, p equals 0.161. Conclusions. This study confirmed the importance of the European guidelines. The inclusion of adequate resection technique as a quality indicator in colorectal cancer screening programs is recommended.